Hey everyone, this is Josh here with Fight Bad Medicine. Today I want to address a question I get a lot in our practice. So we focus a lot on nutrition in our practice as the foundation of health along with lifestyle changes. Now, patients come in and they ask, I went to my doctor and they didn't really talk about nutrition. And they rarely do. So I don't understand if nutrition does work, if diet change does work to reverse illnesses such as heart disease, hypertension, type 2 diabetes. So why doesn't my doctor say anything? Why is my doctor always jumping to medications? Why are they jumping to a beta blocker for high blood pressure? Why are they jumping to metformin or sometimes insulin for diabetes? Why are they jumping to trying to lower my cholesterol with a statin drug? Why don't they talk about diet if it works? So many people will say that it's the money, that the pharmaceutical companies are just trying to make a buck. But the doctors are not interested in that. They don't really have a connection with pharmaceutical companies. They don't have any financial interest in that. So what is it? What's stopping doctors? Do they just not know? Or do they not care? Why is it that doctors are not focusing on diet, not spending ample time talking about nutrition? So in his book, Dean Ornish, in the book called The Spectrum by Dean Ornish, he talks about how he used in his studies a mostly plant-based diet to actually reverse heart disease. He actually saw increased coronary artery flow. So not only did he halt it, but he actually was able to reverse it. And he also talks about other chronic diseases that can actually be reversed also with a mostly plant-based diet or a plant-based diet. So what's the issue? So he actually has a great few paragraphs about this. I just want to read it to you and explain exactly and answer the question that I get from a lot of people. Why isn't it that doctors don't talk about nutrition? So he writes, when I first began conducting research as a second-year medical student in 1977, the idea that the progression of heart disease could be reversed was thought to be impossible by most doctors. They thought that at best, diet and lifestyle changes might slow down the rate at which the disease progressed, but it could only get worse over time. Equally improbable was the belief that most people would be able to change their diet and lifestyle. After we and others proved that the progression of coronary heart disease and other chronic diseases could often be reversed by making comprehensive lifestyle changes, these misconceptions slowly began to change. Now, most doctors believe that heart disease is reversible, so why don't they do it? So here he goes. Then the skepticism shifted. Although most physicians believe that the diet and lifestyle program I recommend works, they often think that the majority of people can't follow it because it's too strict, too hard, and too boring. So why bother? And they said to him, okay, your patient's changed, but you live in California. It's an altered state. They'll do anything there, and you're some kind of guru. You can somehow brainwash people to change. So this approach is basically having a preconceived notion, doctors having a preconceived notion that patients are not willing to change. They don't even give patients a chance to change. So they actually know that diet can reverse many chronic diseases, but they just don't want to spend the time because they don't have faith in the patients that they're actually going to follow through. And yes, there are patients that will not. And even in our practice, where it's known that like we practice natural medicine and you have to put in the work, there will be patients that come in that are not motivated. So I totally understand that in a conventional medicine office, there's going to be many more patients that are not motivated. But you're not even giving people the chance. So I'm speaking to practitioners, please, spend the time with your patients. Just 10 minutes a visit can change their health completely. It slowly you chip away. You make little changes. You tell patients, okay, you know what? I want you to drink more water. You tell patients, you know what? I want you to cut down on how much meat that you eat. You tell patients, you know what? I want you to cut down on how many processed foods you eat. Just these simple changes would make a huge difference. You would probably see chronic diseases being reversed at an incredible rate. You would see the cost of healthcare go down tremendously. You would just see so much change within people's health and within the healthcare field. So please, practitioners, wake up. Talk to your patients about diet and lifestyle. You know it works, so do it. So to the patients that ask me, why don't their doctors do it? Now you know exactly what they're thinking. You know exactly what their preconceived notions are, that they don't believe in you. Tell your doctor, please, tell me what I can do about nutrition and lifestyle, because they know, they have the information. You just have to ask. They have it. You have to help these doctors have the faith in you and spread the wealth, and then they'll have faith in other patients and they'll make the changes. So here at the Arc Wellness Center, we believe that patients can change, and we spend an ample amount of time talking about nutrition and lifestyle. Probably, I would say 80% of our focus is on that. Yes, we use supplements, but we don't even necessarily like to go that route so aggressively. Maybe you need something basic, maybe a multi, omega, B12, vitamin D. It's very, very basic stuff, but most of it is dependent on you changing your diet, you changing your lifestyle. We believe that you can change. Thank you so much for joining me today, and have a great holiday. Take care.